Africa is in transition. There is a huge climate change going on. There is a huge urbanization going on. There is a huge population growth going on. And on top of that, there is an epidemic of antimicrobial resistance, so drugs don't work any longer. And we have no clue where the money comes from. There is a lot of reduction of funding for the health systems in Africa. So under those circumstances, we have to do more with less.
Epidemics, both non-communicable diseases and infections, are a direct attack to health systems and therefore a litmus test for their resilience. Malaria is one such major challenge. The Kisumu County Government Department of Health has faced myriad challenges in the management of malaria.
Kisumu County is a malaria endemic region. The main malaria challenge we had as a county, of course, was getting data and being able to use it at the right time to make decisions.
The knowing of how malaria is distributed in terms of gender, in terms of age group, in terms of which areas they are more concentrated. We just used to key in data from the community unit level, but we were not able to visualize or see that these are the areas that malaria is concentrated.
Patients often seek treatment without testing for malaria or do not seek help in time. When they receive the wrong drugs or no drugs at all, they get complications. Malaria data are typically collected through public healthcare providers. Private facilities are not connected. But the private sector provides almost half of all malaria services in Kenya. So there is a serious blind spot for policymakers. This needs to be addressed, for example, through connected diagnostics.
In the past, we were not able to access this data, and the report has it that about 40% of our patients go to private sector.
One of the challenges that we face when dealing with malaria in Kisumu is that the data is always retrospective. When we look at KHIS, which is the health information system that we use, usually community health workers and the facilities report at the end of the month. So many times you are looking at retrospective data. The second thing is that the data is very fixed because it is facility-based data, and so you can only know how many cases of malaria have been seen in that particular facility. And the third thing is that it does not include the smaller health facilities, the pharmacies that people go to.
Kisumu County has adopted a new digital approach to malaria care, which has proven that it is possible to do more with less. The Connected Diagnostics project, CONDIX, is a co-implementation between PharmAccess and the Kisumu County Government Department of Health.
PharmAccess is a systems organization. We support health systems in Africa, which means providers and patients and payers and policymakers in a coordinated way, because the health system is one organic issue, both of the public and the private sector. We combine that. And Connected Diagnostics is a way to get all those data together and to create dashboards and information channels that can inform policymakers to make the right decisions for malaria at the right time, at the right place.
My main role in this project was to translate the project visions into reality on the ground through coordination of field teams and acting as a liaison between PharmAccess and the county.
In the project, I was a trainer. I was also doing support supervision. And again, I was also involved in commodity management, where we could support the private facilities with the MRDTs. Again, we were involved in waste management.
For us to be able to make prompt decisions, we require this data to be digitized. When you have a strengthened public-private engagement, it's easier for you to fight a disease.
Connected Diagnostics is meant to change malaria management behaviors of both patients and providers. First test for malaria, then treat.
Connected Diagnostics for malaria entirely fits the PharmAccess strategy of putting the patient central. We bring malaria testing as close to the patient as possible, the community health worker, the small chemist around the corner, and we empower the patient to know his or her malaria status. And we try to create channels to support patients in their malaria care and optimize this.
The Connected Diagnostics project brings malaria care closer to patients via a hub and spokes model. whereby patients are tested and treated by chemists or community health promoters and referred to private health facilities when needed. When a patient has fever, they can get tested for malaria at a private health facility, chemist, or by a community health promoter using the Health Pulse app. The photo of the malaria test results is uploaded via the app and interpreted by AI on the back end as quality control and transparency. To encourage data upload and testing before treatment, incentives are provided in the form of data bundles and digital mobile money for every correctly uploaded test. The results are displayed on a real-time geo-mapped dashboard made available to the county for malaria surveillance.
Prior to this project, antimalarials were being given out prior to testing. And what we try to do is to encourage testing before treatment by introducing incentives. So these were digital mobile money incentives as well as data bundle incentives to encourage them to test before they treat and upload their data.
An AI-supported decision-making app, Health Pulse, was developed to assist frontline lay workers in testing and treating malaria or making referrals when needed. The app supports frontline workers in how to test for malaria and, based on the results, treat or refer according to WHO guidelines.
The app works offline with low data usage to suit areas with limited connectivity. It uses visual icons with minimal text. It fits into existing malaria workflows to reduce disruptions to daily routines, and it works on smartphones that are commonly available across Kenya. The app also supports a wide range of RDTs to ensure flexibility in operations related to shifting supply chain availability.
The data from the app is fed into a semi-real-time geo-mapped dashboard that supports policymakers in resource allocation and targeted interventions, as well as community health assistance in managing their CHP units.
I use the dashboard to monitor the activities of the CHPs, maybe based on their performance. At a glance, I can see how they are performing based on their work. Second, it also helped me to do supervision.
Our vision is that at our Public Health Emergency Operations Center, that is where we monitor diseases, that's where our disease surveillance team is. They should be able to see this information on the dashboard so that every day in the morning when they wake up, they're able to see the trends or what is going on where and where they need to intervene.
The Connected Diagnostics project has brought several benefits for both patients and frontline workers via digital decision support and to the county for disease surveillance.
As the County Minister for Health in Kisumu, this project has helped us to integrate the private, the public health sector systems. Access to data from the private sector has made us be able to get holistic view of the malaria status in a certain particular region. We've just done this as a pilot, but at least it tells us on what we can be able to do in a bigger region to be able to diagnose the diseases better. Not only in malaria, because it's a lesson about digitization and the impact of what digitization can be able to do in terms of integration of data and monitoring of diseases that are coming from the community.
Having an application that uses artificial intelligence to identify the malaria cases and to make decisions at that lower level has really helped us to be able to capture the malaria cases and use malaria case management as an intervention to be able to reach out to the communities and be able to identify malaria and be able to treat.
My major role in community activities and majorly in this project. One is to work together with the CHPs in doing malaria testing in their households. We do prompt provision of MRDTs. Whenever someone is lacking antimalarials, I come in or they call and I quickly provide to them. We've seen the number of testing rate increasing. Through your support, we've received commodities and this has improved majorly in malaria testing. These clients are getting treatment at early. Whenever we identify these cases, the positive ones we treat.
With the simple AI-supported app, private providers and community health promoters now test patients before they offer the correct treatment.
As a community health promoter, My main work is home visits, do the assessment, default tracing, doing follow-ups. In most cases, we do test malaria if the kid have fever. Before the helpers came, we were using the DAR. When going to assess malaria, you have to carry the papers and the books, but now the work is easy with the phones, with the Health Pass app. The details of the client is just on the phone. It have also given us knowledge on more types of those RDTs that we are using on the ground. My patient, they know they will get the correct medication, I will do the correct testing. They trust that I will refer them to a correct hospital where they will go for further investigations.
Kazi yangu kama CHV, me wanna visit households. When I reach that household, there are so many things I normally look into. First, I give health talk on issues related to health. I do assessment to both children and older people.
Nimekuwa na Jacob for 3 years now. Amekuwa amenisaidia akanihudumia. Nikikuwa na malaria namuita, anakuja ananitest.
I check for the temperature of the patients, and there are some signs and symptoms like body joint pain, loss of appetite, diarrhea. So when all these symptoms are there, and then the patient has not been tested for malaria for the last 2 weeks, then I'm allowed to do a MDT test. That's where I will know whether this patient has got malaria or not.
Kitambo nilikuwa natembea nikienda huko na hospitali. Nikienda huko naweza panga line nimalize the whole day huko OC. Na hapa akikuja ananifanyia haraka na ananimaliza na nitibu ananipea dawa haraka. Kama ni kitu ya kunirifaa ananiambia enda hiyo OC. Huko nikienda nafanyiwa huduma haraka juu Jacob amejulikana huko. Nikienda na referral wanapita hata wenye wako mbele wananihudumia juu kuna referral.
The support I received from the project to use this tool, normally we are being given data every week to upload the photo, and also the 15 bob per test kit is a benefit we have gotten from the program.
CHV kukuja hapa imenisaidia kabisa juu saa zingine naweza kosa transport ya kwenda huko na yeye nikimtaji anakuja haraka ananihudumia.
The impact I've seen since I started using the app in the community is that right now whenever there's any signs and symptoms of malaria, I'm normally being called to go and do assessment. The issues of time wasted going to the facility are no longer there.
At Russian Pharmacy, we do dispense, we test for malaria, at the same time we advise further. We can also do referral. What made me join the project is that in most cases, we used to have very many clients who used just to come to pick the drugs. But when we heard of the project and the digital reporting bit, which we thought was faster and easier, actually that's what made me think of it.
First of all, they did some testing. So they pricked my finger, took a blood sample, and they were able to do like a litmus test. They also prescribed the drugs once they figured out that I have malaria for me to like go take at home.
Around this area, most of the patients have recognized that we are doing the good work, so the influx of patients has increased.
The fact that they are able to test and treat you without having to go to a hospital, that's like a big plus from me.
I've realized that most of the patients are coming to ask for the test themselves instead of me requesting them to do the test. At the pharmacy, right now we can do the quality testing and accurately.
Majorly, tunafanya dispensing na few tests, especially test ya malaria na basic treatments za malaria. Tungeweza kufanya dispensing over the counter, tunaweza kutibu mtu bila kutest. Tangu project ikam, unaweza convince mtu ule amekuja kununua tu dawa, unaweza mconvince afanye test, at least tunatibu kitu tuko sure nayo. Kuna numerous benefits kwa kutumia hiyo app ya digital malaria juu at least ina keep records. Wewe mwenyewe unaweza feel like unaweza pata data. Nimefanya 10, nimepata 3 positive, hii month nimefanya 10, nimepata 1 positive. Wewe mwenyewe unaweza chukua data ya location yako. After hii app ilikuwa introduced, tulipelekwa training twice. Actually hapo ndo nilikuwa train sana kupima malaria. Tulienda hiyo through the process ya kutrain, tulijulishwa signs za malaria, kuna zile hatukujua.
My role as a lab technician involves investigative procedures in terms of malaria testing. There are different methods in testing that we do here. We do MRDT and we also do the slide method. The impact in using digital diagnostic tools in our facility, we are able to use various types of RDTs from paracheck to fast response. So we are able to see the timing, and also the application has an SOP that we normally use to guide us on how to use the RDT while uploading.
Difference nimeona since tuanze kutumia hii app Health Pulse, tumebuild trust na clients wetu, maintain customers wetu in a way that is not recurrent. The app inatusaidia kujua how many RDTs tutahitaji within a week or a month kufanya stock taking. Feedback receive from our clients kwamba ile turnaround time imekuwa reduced from 30 minutes ya microscopy to 20 minutes kwa malaria MRDTs.
An evaluation study was conducted on the feasibility and acceptability of the app.
This study was interesting, and the feasibility of this study somehow matched what we had anticipated. For instance, we thought that the laboratory technologists and the pharmacists and even the CHPs will like our app and use it. And indeed, from the interviews that we have done with them, we realized that one, they noted that the app was easy to use. They also found it useful. They were able to test many patients, and in some sectors like the chemists, for example, we noted that through use of Health Pulse, they embraced a lot of testing rather than just relying on empirical treatment. The use of Health Pulse and the use of incentives has affected treatment accuracy in some way. Let's say you are giving some incentive to these healthcare workers. Talk about the lab techs, the CHPs, and the pharmacists. When you give them a little incentive, they are motivated to test fast. So what does this imply? This means that if they are testing fast, then they are not shooting in the dark. They are treating what they know. If a patient has malaria, for example, the RDT was positive, they know that the patient has malaria and they are giving the right molecule to cure malaria. And so in this case, I'll say accuracy of treatment has improved by a great percentage.
Setting up a health systems approach, introducing digitization for transparency and efficiency, and stimulating behavior change via capacity development and digital incentives did come with its challenges.
To begin with, we had digital literacy challenges, particularly at the community health promoter level. But through the training that we provided in how to use the Health Pulse app, in the on-site mentorship, they were eager to learn, they were quick to adopt the innovation and implement it accordingly.
In the background, we were training an AI to interpret the MRDT images. We had a few MRDT brands that the AI was trained on, but in the field, we saw some that the AI was not trained on, so it was not able to properly interpret.
Another challenge that we faced during the implementation of this project was reuse of MRDTs, in the sense that an individual would submit a single test more than once. In the bigger picture, this would compromise interventions that are being made at the county level, because they depended on this data to make those decisions at that level. And so a way in which we were able to overcome this, we engaged our field teams to make them understand the importance of having accurate data at the level of decision making.
The technical challenges included having to account for different phone models with varying hardware. We tackled these differences through extensive testing across devices. Another challenge related to syncing data security, especially in areas with unstable internet or limited data. When connected, we use background syncing, data compression, and multi-part photo upload to increase resiliency to these environments.
Some of the challenges that we had was to maintain this platform and to make sure that we received real-time data, and in the meanwhile ensuring the consistency and the accuracy of the data. Some of the exciting aspects, observing that AI-powered diagnostic tools can deliver accurate results in real time, was especially exciting for me. I think it provided tangible proof of AI's transformative potential in healthcare, which gives me great optimism for future innovations in the field.
While Kisumu serves as a powerful example, true scale will be realized when such approaches are systematically applied to the full nation of Kenya, and preferably beyond. Epidemics do not care about borders.
We want to make sure that Kisumu is totally digitized in terms of epidemic preparedness. And it's not only about epidemic preparedness, we are doing it for the whole health system.
We want to be paperless. We want to make decisions almost daily, almost instantly. It's something that we hope that both county and the national government will embrace, so that we don't have any person dying as a result of malaria because of delayed decision making, or maybe the disease increasing because we were not able to make decisions at the right time on when to bring in interventions and how to distribute them appropriately.
This project delivered a proof of concept that this is feasible on the ground, and the next step is to expand towards epidemic preparedness.
This compelling model is ready for adoption in new contexts, as are its principles, that is, real-time digitally enabled data for better decision-making, decentralized care, and local ownership.
We used a bottom-up approach where we created a very strong professional working relation with our field team, and this translated into good results, and as a result the county were also proud, and it created some sense of ownership.
Malaria is still a huge problem. There is not a good vaccine working against malaria at the moment that can be applied to the whole population. In other words, we need radically different approaches to actually get malaria out of this world. And connected diagnostics is one of those approaches that we think can contribute to this.
Now is the time to rethink healthcare systems in Africa.
Kukua FarmTech ni kupeana huduma kwa jamii.
Kuwa CHP ni kujitolea.
As a trained medical laboratory officer, I collaborate.
This project has been digitally innovative.
Digitally empowered.
Grateful.
It's been wonderful.
Very insightful.
Amazing.
Inspiring.
Accessible.
Quality services.
Health is well.
Real-time malaria detection is achievable.